I'd like to talk a little bit about the medical care crisis that we're facing. Sometimes I'd like to think that it might be a government crisis rather than a medical care crisis, but we do have a mess in medicine, and there's a lot of talk about what's going on, not only throughout the country, but here in Washington. But first I'd like to describe how I see the problem developing and what has happened. A lot of people are arguing that free markets can't deliver medical care, which I disagree with. And the problems we face today is not a consequence of the marketplace, it's a failure of the government. This idea of managed care was introduced during the Nixon years. And this was a program designed to force people into medical care and provide PPO and HMOs and tax credits for certain groups and not any others. So we have been enduring managed care over these last 35 to 40 years. And what has developed from this has been corporate medicine. The individuals who were best able to gather up the money passed out by the government or mandated by the government, they became the chief lobbyists. So the drug companies lined up, the health insurance companies lined up, the health management companies lined up, and it turned out that they started running the show and actually confused the problems and made it less efficient. So there was too much management. At the same time, too much of the money was going into these corporations, which were sort of the middlemen, and patients have suffered, the doctors have become unhappy. The main complaint I hear is that medical care costs too much. I can't afford my insurance. And there's a lot of truth to this. But one thing that most people don't talk about is, why are the costs high? Why are the costs of medical care, why are the costs higher than, say, the cost of bread or computers or television sets or whatever? And the truth is, it's a reaction to government. It's a reaction to our monetary policy. We do inflate the money supply. We do have price inflation. But prices go up more so in certain areas that the government gets involved in than in others. So the government's more involved in education and medical care, so you have more inflation there. And that is part of the problem. But over these years, there has been less competition in medicine, and that's been gradual over 100 years or so, where people couldn't enter the medical field without getting all kinds of licenses and protecting special groups. But if there's more competition and there's less insurance, actually cost goes down. So if you look at some of the procedures provided by the plastic surgeons or the eye surgeons who do keratotomies, and they're not under coverage of the insurance company, those prices actually go down. We don't have insurance for medical care. We have distorted that word. Insurance is supposed to measure risk, and you're supposed to buy that protection. So if you want medical insurance, you would be insuring against bad accidents or major surgeries or against cancer, something like that. But today, people expect prepaid services. They want every penny taken care of. They want the drugs paid for, and then that invites abuse. When third parties pay the bills, doctors, labs, and hospital, everybody else, all of a sudden they charge the most, not the least. I experienced medicine before they had managed care, and patients were always charged the least, and nobody went without medical care. The churches and volunteer hospitals and other groups took care of the people. But now everybody has to have this so-called insurance, which doesn't do a whole lot more than boost prices and then cause shortages, and then there's a demand for what? For more government. And that's where we are today. So we're going from corporate medicine, which was deeply flawed and not working, and now the proposal here is to go to government medicine, which is socialized medicine. It's really not worked well anyplace else. People, yeah, they get care if they want to wait and watch, but today, even in spite of our shortcomings, people come to this country still for top medical care, but that will soon change if we want to equalize everything by leveling it and making sure that everybody gets poor medicine rather than extra medicine, extra and better medical care. But we could do better. What we could do is introduce the notion that patients do have rights. Anything that comes out of Washington here, which something will, what we ought to fight for is the fact that we have a choice. We shouldn't be forced into a program. If the government starts a program, we ought to have the right to opt out of the program. We should be very generous with tax credits. Give tax credits for the entire amount of money you spend on medical care so that you can be independent. The concept of medical savings accounts is a good concept, and we should promote that and encourage that. And we should demand privacy. I mean, this is one of the tools that the government agents always use, and they've already set the program up. It's been passed already, where there will be essentially no medical privacy. So there's a lot of things that could be done through the tax code, the tax credit, and also protecting the individual's privacy. Now, the one other thing that we could do, we could pass legislation that would actually help along these ideas of the problem that we have with malpractice suits. What we ought to do is talk about getting rid of the antitrust laws against the doctors, where they could negotiate with their patients and get the attorneys out of the ball game, where you would agree on an arbitration board and get a tax credit for buying an insurance policy like that. So there are ways you can, through the marketplace, literally reduce this fear-mongering and excessive costs that are involved in litigation against doctors. Because right now, believe me, if you get a bump on your head and you come to the emergency room because it's a third-party payment, we're fearful as doctors of missing something due to the attorneys. Believe me, you can't walk out of the emergency room without a $10,000 or $15,000 bill, and that is not the way it should be. There are alternatives. Now, I do want to say that the Campaign for Liberty did such an exceptional job when it came to 1207 and at the grassroots level. So I suspect that the Campaign for Liberty, if they get behind some of this free market approach to medical care, they can do a tremendous job in changing the course here in Washington, because right now we're on a course towards socialized medicine, and it doesn't have to be that way. I never dreamed it would be, we'd see the results that we have seen at the grassroots level, which then affected Washington with now over 230 co-sponsors for 1207. The same thing could happen with medical care. So I would encourage all who believe in freedom and liberty, understand that medicine is no different than any other service. Freedom really works and does a much better job than coercion and just another gigantic government program, and socialized medicine can't work.
Congressman Paul, you are a constitutional expert and you talk a lot about the Constitution. What do you think of this argument that the state has a constitutional right to make someone buy a good or service just because they're a resident, not because they're driving and need a driver's license, but just the fact that they are a resident?
No, the way I would understand the Constitution, the federal government can't go in and prohibit the states from doing bad things. And I would consider that a very bad thing, but you don't send in a federal police force because they're doing it and throw them into court. So they do have that leeway under our Constitution. But we have big trouble in this medical care problem, and we have drifted so far from any of our care being delivered by the marketplace. And once you get the government involved, and both parties have done it, they've developed a bit of a medical care delivery system based on corporatism. The corporations are doing quite well, whether it's Obama or under the Republicans. The drug companies do well, the insurance companies do well, the organized medicine do well, the management companies do well. The patient and the doctors suffer. There's a wedge. Every time you hit the government get in here with these regulations and have these mandates, there's a wedge driven in between the doctor and the patient. We have to get the people more control of their care, and that's why these medical savings accounts could at least introduce the notion of market delivery of medical care.
People have to buy health insurance. Was that one of the things that worked in Massachusetts?
But I was trying to get your attention a little while ago. There's 8 of us up here. I'm a physician, but you sure weren't going to ask me any medical questions. But I would like to address that just a little bit. First off, you know, the governor of Texas criticized the governor of Massachusetts for Romney Care, but he wrote a really fancy letter supporting Hillary Care. So we probably ought to ask him about that. But mandates, that's what the whole society is about. That's what we do all the time. That's what government does. Mandate, mandate, mandate. And what we talk so much about the Obama mandate, which is very important. But what about Medicare? Isn't that a mandate?
Everything we do is a mandate. So this is why you have to look at this at the cause of liberty. We don't need the government running our lives.
My position on this is very simply that we need to cut spending. We don't need to throw people out in the street who are dependent, that we have taught to be dependent on medical care. So I don't, even though I don't believe those programs are constitutional for a minute, I don't believe the federal government should be in education.
You would abolish
we should
Medicare
be running
if you
medical
could,
care.
wouldn't you?
Now wait, let me answer. Let me answer this. That I would cut, in order to make sure they didn't lose their medical care, but I would cut those hundreds of billions of dollars overseas spending in these wars. I would not allow Obama to expand these wars, and I would keep that money here and tide people over until we came to our senses here and live within our means. That is what we need to do. That is an answer to the Medicaid and the Medicare and the medical problem that we have in this country.
You would abolish Medicare, wouldn't you?
Who, me?
Yeah.
No.
Why not?
No, I just got done explaining to you.
No, you didn't. Not exactly.
Eventually,
it's a socialistic program
okay, now
that
let me go through it
libertarians would
again.
abolish. It's the first one you'd abolish, isn't it?
Now let me explain to you. It's going to abolish itself when we go bankrupt and the money fails, and we're on the verge of a dollar crisis, and the checks won't buy anything. The medical care in this country is going down. So what I want to do is, at least in a temporary way, is preserve what we have and not hurt these people. So listen once again. The only way we can do this is we have to live within our means. We have to cut. I want to cut the war spending of Obama. I want to cut all this expense overseas. I've joined with Barney Frank in this effort to cut spending overseas, bring troops home from Korea, bring troops home from Europe, and help these people who are dependent on the government. I think it's wrong to be dependent, and you're right. It shouldn't happen. We should work for the day when these individuals can take care of themselves once again, be self-reliant. I practiced medicine before Medicare came in. And when we didn't have Medicare, people were never...
abolish Medicare. That's just code language for abolish Medicare. You want to get rid of Medicare.
Oh, yeah, okay. If you want to keep putting words in my mouth, go ahead. But I think people who are listening here at this program will have reason to understand what I'm saying. See, you're ignoring the fact on how you work your way out of this. I have the transition program. So what happens in 10 or 20 or 30 years from now is another subject. I'm trying to say, if you want to have medical care for the elderly or education for our children, you can't do it by running up trillions of dollars of debt a year. That is my beef. My beef is this, that we have to cut. But I don't come out and say, oh, well, we're spending too much. What we have to do is cut Medicare. We want to abolish Medicare. You're absolutely distorting my views. My views are this, and I should get a lot, and I do get a lot of support from the left because they understand. The true progressive understands what I'm saying, because I'm saying stop the wars. Stop this warmongering. Stop this war on terror and assassination.
Congressman Hunter, the Federal Agency for Healthcare Research and Quality recently reported that both Latinos and blacks receive significantly worse, in their words, medical care than whites in the United States. 1 out of 3 Hispanics, 1 out of 5 black Americans is uninsured. Hispanics are 2.5 times as likely as a non-Hispanic white American to be uninsured. 1 of 3 Hispanics hasn't been to the doctor in more than a year. And as has already been mentioned, diabetes, asthma, hypertension are untreated or undertreated in communities across America. What does your health care plan contain to address some of these disparities in access to care and access to quality health care?
We've had managed care in this country since the early 70s, and it hasn't worked well. It's very, very expensive, and it's the fault that we changed our ERISA law and our tax laws that created this corporatism that runs medicine. Wall Street rakes off the profits, the patients are unhappy, the doctors are unhappy, and it's a monopoly now. Who lobbyists us in Washington? The drug companies and the HMOs, they come, and now what is the cry for? Socialized medicine. That's not the answer. We need to get the government out of the way. Inflation hits
hits the middle class and the poor the most. Those are the people who are losing it. It's just not minorities, anybody poor, because inflation wipes out the middle class, and we have to deal with that. If you have a product that's not dealt with by government, prices go down when you have modern technology. In medicine, with all this technology, prices still go up, but that's because the government is involved. We don't have enough competition. There's a doctor monopoly out there. We need alternative health care freely available to the people. They ought to be able to make their own choices and not controlled by the FDA, preventing them to use some of the medication.
Health insurance for poor children. This makes you alone in politics, just about.
That's right, and I think there'd be less poor children needing help if we had endorsed the ideas that I'm talking about. I was in medicine before government was involved, and there were a lot of poor people, and there were a lot of church hospitals. I worked in a church hospital partially for experience and partially to work in an emergency room, and I was paid $3 an hour in the early 1960s, but there was no government insurance. But everybody got taken care of, and then nobody was charged. But now today they come in and everybody's charged the maximum amount of money, or they're put on to the rolls. The government will pay it, put them on Medicaid, and jack the bill up. I mean, the attitudes are completely different.
Before government got involved, people stepped forward and took care of poor people.
Absolutely.
Now we expect government to do it.
We expect government to do it, and about all it does is when the government gets involved, say in education or medicine, instead of increasing the quality of the care or the education or spreading it, it pushes prices up. So the quality of education and medicine has gone down. Less people are getting the benefits, but look at where the prices have gone up the most. It's in the areas where the government is most involved.
It's hard for people to imagine how the care could be given without government once you're used to government. But you're an obstetrician. In your own practice, you don't take Medicaid or Medicare. How do people pay for it?
Never did. Sometimes they'll pay a small fee. Sometimes they would pay nothing. And that's the way I was taught. There's a hospital in my district in Galveston, Texas, and it's called the Shriners Hospital. It's well known. It's a burn hospital. And if you don't have any money, and you can go there, whether you're a child or an adult, you can be taken care of. And if you can pay, you pay. If not, you'll still be taken care of. So you would have a lot more solutions like that. The society and the economy would be so much richer.
We'd be richer because government wouldn't be taking 40% of the money in taxes?
That's right. I wouldn't have an income tax. I wouldn't be taxing people to run the educational system or running the medical system.
This is hard for people to imagine. Medicare, free medicine for people your age. How can elderly people be taken care of without a big government program like that?
Right now it's difficult because we've made a whole generation or two dependent. But the question that we ought to ask is, if we continue to do what we do, how are we going to finance it? Fewer people going into the workforce, cost of medicine going up. There's no funding for Medicare. It's under a greater threat than Social Security.
The promises being made now are not going to be kept. Promises of free health care for elderly people.
No, they can't. Of course, there's no such thing as free health care. And I think I have the only solution. People see me as a threat to Social Security and Medicare, but I think I'm the only one that has a real solution, because I've never voted to spend any money out of the Social Security Trust Fund, because I voted against all those appropriations.
Your party created a prescription drug program. You voted against it. Don't elderly people need these drugs?
Yeah, and that's why I voted against it, because their government programs fail to work. And a lot of elderly were, and still are, furious over that program because it's so complex and difficult.
But a lot of people like it.
Yeah,
hey, I'm getting my drugs paid for. They're free.
You know who else likes it? The drug companies. They spent quite a few millions of dollars down there. They did the highest lobbying, so the profiteers were the ones who really pushed that program. But the assumption shouldn't be made that if you didn't have it, people wouldn't get, their drugs. There are other ways. The market is designed, if you follow the market, to lower prices, not raise prices.
You vote against all this stuff. Don't your colleagues hate you?
No, I think I'd like to think subtly that maybe they respect me a little bit, you know. It's because every once in a while they'll come up and say, I wished I could get away with what you do. But, you know, I think people in my district, and hopefully in this campaign, and I'm running now, that people will respect these views and come around to understanding the economics. And I think that is what's happening. I think people are realizing this country is bankrupt and we have to do something. It's not working, so they're looking for some solutions.
Thanks very much, John. And I have Dr. Paul Collins, who you've been running a family practice in Manchester for how long?
27 years.
Nice work. So not surprising your question is related to health care. What's your question, sir?
Yes, sir. As a member of the baby boomer generation, I've been contributing to Medicare through payroll taxes for over 30 years. How do you propose to keep Medicare financially solvent for the next 50 years and beyond?
Let's start with Dr. Paul on this one.
Well, under conditions, it's not solvent and won't be solvent. You know, if you're an average couple and you paid your entire amount into Medicare, you would have put $140,000 into it. And in your lifetime, you will take out more than 3 times that much. So a little bit of arithmetic tells you it's not solvent. So we're up against the wall on that. So it can't be made solvent. It has to change. We have to have more competition in medicine. And I would think that if we don't want to cut any of the medical benefits for children or the elderly, because we have drawn so many in and got them so dependent on the government, if you want to work a transition, you have to cut a lot of money. And that's why I argue the case that this money ought to be cut out of foreign welfare and foreign militarism and corporate welfare and the military-industrial complex. Then we might have enough money to tide people over. But some revamping has to occur. What we need is competition. We need to get a chance for the people to opt out of the system. Just to talk about opting out of Obamacare, why can't we opt out of the whole system and take care of ourselves?
All right, let's question.
Yes, thanks, John. I'm here with Lydia Cumby. She lives in Franconia, and she is a naturalized citizen who moved to New Hampshire several years ago from Minnesota, of all places. And she's got a question about immigration.
As a naturalized American citizen who came here legally, I would like to know how you, as a president, plan to prevent illegal immigrants from using our health care, educational, or welfare systems.
And so, Dr. Paul, to you on this one, the question comes up, though, once they're in the country illegally, you have compassion sometimes bumps up against enforcing the law and state budget crises. A 5-year-old child of an illegal immigrant walks into an emergency room. Does the child get care?
Well, first off, we shouldn't have the mandates. We bankrupted the hospitals and the schools in Texas and other states. We shouldn't give them easy citizenship. We should think about protecting our borders rather than the borders between Iraq and Afghanistan. That doesn't make any sense to me. But on coming in, you know, there was a time when government we didn't depend on government for everything. There was a time when the Catholic Church actually looked at them.
Should they get care? Should taxpayers have to pay for that care?
No, they should not be forced to, but we shouldn't be penalizing the Catholic Church because they're trying to fulfill a role, and some of the anti-immigrants want to come down hard on the Catholic Church, and that is wrong. If we believed in our free society, matter of fact, this whole immigration problem is related to the economy. People aren't coming over as much now because it's weak. When we had a healthy economy, some of our people didn't work and people flowed over here getting jobs. So there is an economic issue here as well. But no, if you have an understanding and you want to believe in freedom, freedom has solved these kind of problems before. You don't have to say, oh, you're not going to have care, there won't be any care, and everybody's going to starve to death and die on the streets without medical care. That's the implication of the question. That's just not true, and you shouldn't accept it.
First Coast Tea Party, Jacksonville, Florida. My question, how will you convince senior citizens that Social Security and Medicare need to be changed and get their vote?
Congressman Paul, let me expand this conversation. Do you agree with Governor Perry that Social Security is a Ponzi scheme?
Well, I agree that Social Security is broke, and we spent all the money, and it's on its last legs unless we do something. One bill that I had in Congress that never got passed was to prevent the Congress from spending any of that money on the wars and all the nonsense that we do around the world. Now, the other thing that I would like to see done is a transition. I think it's terrible that the Social Security system is in the problems it has, the problems it has. But if people wouldn't have spent the money, we would be okay. Now, what I would like to do is to allow all the young people to get out of Social Security and go on their own. Now, the big question is how would the funding occur?
My question is, health insurance is expensive because health care is expensive. What is your plan to reduce the cost of health care so that our insurance premiums and other related costs can also be reduced?
You know something about this subject. Let me ask you this hypothetical question. A healthy 30-year-old young man has a good job, makes a good living, but decides, you know what? I'm not going to spend $200 or $300 a month for health insurance because I'm healthy, I don't need it. But, you know, something terrible happens, all of a sudden he needs it. Who's going to pay for if he goes into a coma, for example? Who pays for that?
In a society that you accept welfareism and socialism, he expects the government to take care of him.
What do you want?
But what he should do is whatever he wants to do and assume responsibility for himself. My advice to him would have a major medical policy, but not be forced.
But he doesn't have that. He doesn't have it, and he needs intensive care for 6 months. Who pays?
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
But Congressman, are you saying the society should just let him die?
No. I practiced medicine before we had Medicaid in the early 1960s when I got out of medical school. I practiced at Santa Rosa Hospital in San Antonio, and the churches took care of him. We never turned anybody away from the hospital, and we've given up on this whole concept that we might take care of ourselves, assume responsibility for ourselves, our neighbors, our friends, our churches would do it. This whole idea, that's the reason the cost is so high. The cost is so high, we cause a dump it on the government, becomes a bureaucracy, it becomes special interest, it kowtows to the insurance companies and the drug companies. Then on top of that, you have the inflation. The inflation devalues the dollar. We have lack of competition. There's no competition in medicine. Everybody's protected by licensing. We should actually legalize alternative health care, allow people to practice what they want.
What is your plan to balance the budget and get this spending under control so that my children's share of the debt is erased without compromising my retired mother's already tenuous financial future?
Senator Santorum, staying on the issue of spending, budget deficits, you voted for the prescription drug benefits for seniors when you were in the United States Senate, costing about $1 trillion. If you had to do it over again, you wouldn't vote for that. But if you were president of the United States, would you repeal prescription drug benefits for seniors under Medicare? Congressman Paul, what about you? Would you repeal it?
Well, we shouldn't have never started it. I voted against it, but that sure wouldn't be on my high list. I would find a lot of cuts, a lot of other places. Matter of fact, on Social Security, it is already being reformed because the cost of living increases aren't there, so the value is going down. So, no, there's places we should cut, and we spend, and I'm not sure I can get anybody to agree with me on here, on this panel, but we spend $1.5 trillion overseas in wars that we don't need to be in, and we need to cut there and then put this money back into our economy here. And that is the only way to achieve it. Then it still wouldn't be enough in order to get some people out. What we need to do is cut the Department of Education, the Department of Energy, and all these parts and get rid of them. Then we can do it.
Congressman Paul, you have said that medical malpractice awards are creating a crisis in the medical industry, driving doctors out of the business. We also know the CBO has projected that tort reform could save the federal government $54 billion over 10 years. So why are you against federal tort reform?
Because the federal government shouldn't be involved. It's a state matter. Tort law is a state matter. And it's a tough vote for me because as a physician, I know doctors are on the receiving end, and it does push up, the cost of medicine. But if you look carefully at all my legislation, I have offered a free market alternative to this, to allow the doctors to negotiate, to make contracts, get them out from under the monopoly control laws, give tax deductions for insurance policy where there's no fault insurance, And there is a way in the private market today. We can't contract with our patients for a third-party third-party settlement, and that takes it out of the market, turns it over to the attorneys. If they accept my position on this, a free market approach, and not a nationalized tort law control of this, believe me, we'd put all the trial lawyers out of business, and they wouldn't get most of the money that comes from all these lawsuits when they're suing doctors.